Patricia, why don't you tell me more or less how you first noticed signs of COPD, what they were, and when did they start, when you think it started?
I believe it started in 1996, where I was suffering frequent bronchial infections. The doctor sent me for tests, and they found emphysema, COPD, which is the emphysema and the chronic bronchitis.
How many times have you been hospitalized for bronchitis and pneumonia? And I believe you had an episode where you actually went into pulmonary arrest.
As for the number of times of being in and out of the hospital, sometimes it will be twice a year, sometimes I might go a year. Mm-hmm. Excuse me. In 2001, I went to have a breathing problem treatment, and there was some kind of tachycardia. They kept me in for observation, and I woke up 5 weeks later in a different hospital on a ventilator. I remained on that ventilator for approximately another 3 weeks. I went into respiratory failure at the hospital that I was at. Since then, things have been pretty difficult for me as far as, you know, my disease progressing, and just my basic way of life declining, which it declines like people would not believe.
Tell us about your use of oxygen at home.
I used to use oxygen just at night time for sleeping. Now I use it constantly, day and night. I have great difficulty sometimes walking, even to the fact of going into the kitchen and fixing myself something to eat or making a cup of tea. Sometimes it is very, very difficult. A shower it takes me 2 hours to take a shower and to get dressed again, because of frequently doing one thing and sitting down, doing another and sitting down. It just takes your whole day doing the small things that used to take just a few minutes.
All right. What kind of medicines do you usually, that your pulmonologist has recommended you taking?
At the moment I am taking my rescue medicine, which is Ventolin. I also take Advair 500/50. I also take an ipratropium bromide nebulizer treatment twice a day, and regular vitamins.
Yesterday you received some autologous cells along with some various type of factors, stem cell factor and vascular endothelial growth factor and granulocyte colony stimulating factor. Did you have any adverse effects from that at all?
I had absolutely none.
Okay, thank you.